poison yourself, and they got a whole meme that says.
Oh, good. So it's like a how-to, a tutorial, if you will.
Check, 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 check. 1, 2, 3, 1, 2, 3. Check, check, check. I'm outside OCH Regional Medical Center where, like many hospitals across the state, they struggle with the number of patients coming in due to the coronavirus. State health officials.
Doesn't say who it belongs to, who his meme is, or whatever.
Okay.
No one wants to be put in the spot where they're forced to pick who gets a bed and who does not.
Right now at 6, Delta surging, hospitals strained. Now Mississippi's top health experts want a change to come soon before the pandemic gets worse. Plus, he's been the spokesperson for Mississippi's COVID situation since the beginning, but some people are claiming he's in it for the wrong reasons. Mask mandate in Oxford, but who won't have to worry about putting one on and why? We'll have a live report later on this half hour. And after 60 years of standing up, smokestacks in Alabama decided to create a lot of smoke when they came crashing down. And we're pretty excited and jumping the gun because Friday Night Fever is here. And the game of the week will feature 2 big-time rivals. We'll meet one of those teams later on in the show. WTVA 9 News at 6 starts right now.
Live, local, late-breaking. This is WTVA 9 News.
Hello, everyone. Good evening to you. I'm Emily Leonard. Craig Ford is working behind the scenes tonight. Thank you for joining us for WTVA 9 News at 6. Mississippi health officials met virtually this afternoon to clear up some misconceptions surrounding the coronavirus. WTVA's Rhea Thornton is joining us live in Oktibbeha County, where she sat in on the meeting and tells us what they had to say.
Emily, I'm outside OCH Regional Medical Center where, like many hospitals across the state, they're struggling with the number of incoming patients coming in because of the coronavirus. State health officials are hoping to see change soon.
No one wants to be put in the spot where they're forced to pick who gets a bed and who does not.
During a virtual meeting this afternoon, state health officials reported an additional 3,385 cases and 22 deaths today alone. State epidemiologist Paul Byers said he doesn't feel it's safe to assume we've hit a peak in this wave yet.
We'd love to be able to say that it's plateauing. I can't say that it is right now. We've had a little bit of a slowdown in the numbers, but that doesn't mean that tomorrow we won't have an increase. We've seen some leveling in the numbers of hospitalizations, but guys, they're still very, very high.
This includes impacting children. Byers reported that Mississippi lost another child to COVID, this one under the age of 5, making it 6 children total. Byers also clarified a previous statement about ivermectin calls to poison control. He said 2% of the calls to poison control were about ivermectin, and 70% of the calls about ivermectin included individuals ingesting livestock medication. However, Byers said he doesn't want people to lose focus on the important message.
Don't miss the important bits in this, and that is that people have been taking livestock medication, and it's highly dangerous and it's highly toxic.
Byers also mentioned, along with the younger age groups, the variant is also impacting the lives of the elderly. He said about 50% of the deaths over the past 2 days were people over the age of 65. Reporting live in Starkville, Rhea Thornton, WTVA 9 News.
And the State Department of Health reported more than 3,000 new cases today and more than 24 deaths. The hospital in Oxford is swamped. City leaders hope its new mask mandate will decrease the number of cases. At a special board meeting yesterday, Dr. Michael Corey of Baptist Memorial Hospital said all the other hospitals they work with in the region are also at max capacity. The hospital is struggling with getting patients who suffered strokes and other medical traumas the help that they need. Corey said the sickest patients are getting medical attention first. And one of the nation's highest medical officers made his way to Mississippi this week. Dr. Bachara Chukar met with medical leaders, physicians, pediatricians, in Jackson to learn more on how the state is trying to get more people in Mississippi vaccinated. To stop the rising case numbers, Dr. Kuchar said that more folks need to get the shot. Doctor also discussed the strain that state hospitals are feeling because of the surge of the Delta variant. Mississippi's top health official says he's receiving threats from people spreading lies about his family. This as he urges the public to get vaccinated against the virus. Mississippi saw a rapid rise in cases since early July, driven mostly by the Delta variant and a low vaccination rate. The state health officer, Dr. Thomas Dobbs, tweeted that his son, who is also a physician, receives a World Bank funded kickback when Dobbs promotes fake vaccinations. Dobbs says that he does not receive any money from promoting vaccinations and that he is very proud of his son and his daughter-in-law's accomplishments. He ended the tweet by asking folks to stay informed and keep their loved ones safe by getting the vaccine. More antibody treatment is on the way. North Mississippi Health Services, as well as the State Department of Health and the U.S. Department of Health and Human Services, announced that it expanded its access to monoclonal antibody treatments. The treatments will take place at 6 hospitals with NMHS. They will also be available for those who are at high risk of developing severe COVID, who tested positive for COVID, and those unvaccinated who are exposed to someone who is positive. If administered within 10 days of onset of COVID symptoms, the on-time therapy is highly effective in neutralizing the virus and preventing symptoms from worsening. And it looks like booster shots will likely be recommended for people who got the Johnson & Johnson vaccine. The company says phase 2 studies show people who received boosters 6 months after the initial dose showed a 9-fold increase in antibodies from a month after the first shot. That data comes days after the Biden administration recommended booster shots for people who got Pfizer and Moderna's vaccine. Recipients of those shots became eligible for a booster 8 months after receiving their second dose. It's been a hectic semester for students in Calhoun City already. After starting in the classroom, switching to virtual learning because of the virus, and now today the kids are back at school. More than 400 students went back to class this morning. School leaders decided on a mask mandate as a health and safety precaution for both the students and staff. Still, the first-year principal, LaKenna Whitehead, said they are just excited to be back.
It feels great to have the kids back in the building. These are some great kids here at Calhoun City High School. The main thing we're here for is to teach the students. So there are a lot of things that can affect that, and that's where safety order and structure comes in. So we've been very proactive, making sure our kids are safe.
High school was set to play Houston in football this Friday, but the Leaders canceled that game.